Giving consent for a medical treatment is necessary, no matter what's going to happen to you. From an examination to an operation, before it can happen, you have to say that you understand the risks and the benefits.
Firstly, it has to be informed.
The doctor will explain the risks involved, what can go wrong.
If they have a pacemaker and they're on anticoagulants or antiplatelet drugs at all, we always liaise with either the general practitioner or their cardiologist.
I'm on blood thinners, yes. I haven't got diabetes, but I do have a pacemaker.
We usually just check that the pacemaker has been regularly checked.
So I have had a cardiac arrest in the past. So yeah, there's a few things there, and asthma. So they're all on the list.
Pain medicines, vitamins, supplements, all those types of things also have to be factored in and assessed. There is evidence to suggest that medications like fish oils can prolong bleeding time. Diabetes medicines have to be adjusted before procedures.
This has priority, and the management of the diabetes just has to fit in with it.
We want to be absolutely sure that you, number one, understand what you're going to have done, all the risks associated with having it done, and also what happens after the test is done.
We check your medical history, your weight, medication, that you're not pregnant. We need your permission to share relevant information with all the doctors and nursing teams that look after you and the funding agencies responsible for processing the cost. However, the tough bit is that you have to hear what could go wrong, which can be worrying, but it's a vital part of the process. Today's consent is about oscopies, colonoscopies and endoscopies. Okay, food in your stomach goes into your small intestine where most of it is absorbed and digested. Next stop, the large intestine. Excess water is absorbed back into the body. Undigested food and fibre are processed as waste. A colonoscopy looks at your large intestine through your rear end. An upper endoscopy works at the other, putting a tube through your mouth to look at your gullet or esophagus, stomach or small intestines.
We're just going to have a little look down for you.
Correct.
You'll normally be sedated, which makes you feel a little bit drowsy.
I'm not quite asleep, but almost asleep most of the time.
I think I had a dream, but I don't know what it was. There you go.
They are recommended by a GP to investigate things you've described, such as pain, problems swallowing, perhaps bleeding when you go to the loo, or to review something that's been found already, like pulps, little mushroom-like things that might need removing or treating. The benefit is finding out what is going on inside.
They found about 20 polyps that they removed, but none of them were cancerous and none of it was a worry or anything like that.
We try to detect polyps early on before they turn cancerous, so we can remove them and analyse them under the microscope.
Up to someone with your fingers, thank you.
I want to be here for my children, and if you don't take care of your health, and especially Indigenous health, where we've got diabetes, cancer, heart disease, things like that, well, you're not going to be around for much longer. So it's the most important thing to get checked.
Complications are rare. A nurse will be monitoring you all the time for any procedure, and if you feel anything, it can be dealt with straight away.
It doesn't matter if people wake up in the middle, and we often talk to them and just say go back to sleep, and they often don't have any recall of that.
What I do is I follow up the patients a couple of months after they've had their procedure to see if they had any complications or any issues.
There are common risks: sore throat or a tummy ache for a few days, depending on which end the tube goes in, feeling a bit sick, dizzy, headaches, a bruise where they inject the sedative, aches and pains.
I remember the risks well.
Stuff that most people can deal with. Having a minor allergic reaction to the medications on the day is regarded also as common risk, but that's one that we can deal with easily enough.
I suppose you do feel a little bit tired after the anaesthetic.
I might have felt a little bit tender, but not to the point where I go, oh, I've got to go back to bed, I feel tender. I carried on with my day, really.
Then there are uncommon risks. We're going up a level now.
There could have been some bleeding.
The risks quoted for polyp removal from the bowel would be about a 1 in 100 chance of bleeding.
It usually stops by itself. If it doesn't, you might need some extra blood or an operation. Removing a pulp from the food pipe or stomach can also cause bleeding, but can usually be stopped through the endoscope. The tube going into your mouth could damage your teeth and jaw.
There could have been some perforation in the bowel.
Damaging you with a telescope that goes into your body. It's called a perforation and might need surgery to repair it.
But again, this is very rare. For instance, for colonoscopy, it would be about a 1 in 1,000 risk of that, and for an upper endoscopy, a 1 in 5,000 risk.
I suppose your heart can stop under the general anesthetic. You can fall off the table. Things like that.
Usually there's nothing. We don't get very much back with complications. If you have ongoing issues, then you go back to your GP and get another referral to us.
Now, we might miss something. That risk gets higher if you haven't prepped properly. Let me show you. Close your eyes if you're squeamish. We just can't see what's there. Putting the scope down into your stomach through the mouth can cause food or saliva to get into your lungs, causing an infection. Lying too long in one position could temporarily give you a dead arm. Any existing illness could get worse. You could have a heart attack or get pneumonia. Finally, and even more rarely, you could get a blood infection, have a stroke or a severe allergic reaction to the meds on the day. In case you're off and running down the street, just know that it's incredibly rare for any of these complications to happen or lead to death. You have to balance the risks with the risk of not checking things out.
My dad passed away when he was 74. He just thought he was constipated, and treating himself instead of going to the doctor. He had stomach and bowel cancer, and now our family members are very proactive in going for regular checks.
You know, you don't want to get bowel cancer now, do you?
Everything has a risk. I'm happy to go ahead with something like this if it's going to potentially save my life down the track.
The only risk is not getting it done.
I think the benefits outweigh the risks, yeah. Because you need to really know whether you've got any polyps or anything going on.
The very safe procedures, I would say it's probable that hundreds are done in Australia every day.
I'm going to slide this over the top of your tongue.
We've got great staff and we all look after you.
Yeah.
I don't think you should worry.
You feel so much better after it's done. You know you haven't got any problems in your bowel.
I didn't even know it had happened.
Piece of cake. Didn't feel a thing.
Well, once you've completed this video process, then the next thing that will happen is that you'll get a phone call from the pharmacist.
So I'll dial in on my side first. They'll dial in on their side. They pick a little video camera and then they'll join a little conference with me. We're getting really good range of people using it, from 70-year-olds to 20-year-olds that are coming in for any procedure.
And they will essentially run through all the medications that you're taking.
We just make sure that everything is taken in the safest way possible.
So we're going to run through all of this again on the day of your test. And if you have any questions, you can jot them down and we can answer them on the day, or you just contact us by email or by phone and we can try and address those issues for you.
Beautiful.